Since the state's HIV outbreak began, one person has died, 170 others have been infected.
Yeah, but with the number of new cases slowing down, the state wants to hand over control of the crisis to local officials. But as 24-Hour News 8's Bennett Haberly explains, that could present some new challenges. Bennett?
Lots of challenges, Lori, because this is unprecedented. As state health officials announced it was time to hand over managing the crisis and patient care to local officials, the locals were still trying to finalize plans. When the state's emergency response ends this month, this building in Austin that has treated HIV patients will close.
And right now we're still in the transition stage, so things are a little hairy, of course.
That's left local officials like Scott County Public Health Nurse Brittany Combs scrambling to find a new place to house a county-run needle exchange that's provided clean needles to infected drug users.
That building has not been finalized. There are multiple different candidates for a building.
The hope, state officials say, is that a new building could also potentially house counseling and healthcare signups, as was the case with the Community Outreach Center. State Health Commissioner Dr. Jerome Adams says the state will spend up to $2 million now to beef up its crisis response, including hiring a county health nurse, 3 HIV specialists, and another nurse for the county jail.
I want to be clear again, and I said this in the beginning, we are not pulling out, we're not passing the baton, we're trying to figure out how we can run together. Local response is imperative.
It's going to take a lot of resources to do that, and we're still getting all the players to the table to make that happen.
Scott County Sheriff Dan McLean has invited IU health doctors to begin testing inmates in the jail. But this state-to-local transition has not been without hurdles. IU Health moved out of Foundation's family medicine in May after its physician, Dr. William Cook, and the city of Austin partnered with the AIDS Healthcare Foundation, a nonprofit that does HIV work. State and local health officials acknowledge IU did not want to work with AHF.
There have been certainly concerns from IU about the past reputation of the AIDS Healthcare Foundation and some activities that have occurred in the past.
But the state's deputy health commissioner added AHF and Dr. Cook now have community support and will offer care for HIV patients. The state and community's goal here, to not only treat the HIV crisis, but the drug habits and behaviors that got it there. 11 people have been identified as virally suppressed, meaning they are unlikely to pass it on out of those 170 infected. Health officials say the more people who get tested and get on medication, the more likely the number of virally suppressed people that will increase. Still, that figure has to be juxtaposed with the 46 people who health officials cannot find and the 21 people who refused treatment on top of that other person who died as a result of HIV.
My goodness. So could there be another outbreak like this in another county?
Well, they're hoping no, obviously. Yeah. They don't want to see another Scott County, but there are a lot of valuable lessons that have been learned out of Scott County. The state has now expanded training to HIV, or for HIV, in 7 other counties, and we know also that Fayette County and Madison County are now considering needle exchanges because of their high rates of hepatitis C.
Just want to make sure this does not happen again.
Exactly.
All right, thank you, Bennett.
Sure.